This is Dr.RUkmani and you're watching Everyday Health Cell. My today's topic is Restless Leg Syndrome, RLS. Rest is a neurological disorder, neurological condition in which you are intent to move your leg constantly. There is a urge to move your leg. This affect all age group, but usually middle age brackets they are more affected. And the gender, yes, this affect both the gender, but women they twice have restless leg syndrome. Causes and risk factors for restless leg syndrome. Causes and risk factors. So, there is not definitive cause, not a single cause, but yes, there are genetic predispositions and some environmental triggers. And these genetic predispositions are, this is believed that there are more than 5 gene variations. So this runs in the family for restless leg syndrome. There are more than 5 genes variation. So yes, it runs in family, and there are some triggers, some substance we can say, and these are alcohol, caffeine, tobacco. So these are certain substances that trigger, that increase your symptom. So you move your leg. And with that there is a constant movement of the leg during night particularly and during rest time, and there's an unpleasant kind of sensation. There are sensory symptoms that you feel, there is a crawling sensation, formication, there are some insect inside. So these are the sensory symptoms, some abnormal sensation in your leg during rest or during night time. So you feel fatigue during daytime and you feel sleepy during daytime. As a conclusion, this is believed that you have restless leg syndrome. There are low level of iron in your brain. Though your blood iron level they are normal, but low level of iron found in your brain. Disruption of dopamine, or we say imbalance of dopamine pathway. Dopamine is a neurotransmitter, and yes, if there are imbalances, disruption in this pathway, so you have these kind of neurological symptom. You move your leg constantly. This happens in Parkinson disease. Same, there are disruption of dopamine. So there are constant movement in Parkinson disease. So there is an association of dopamine imbalance, disruption, and restless leg syndrome. If you're taking treatment for allergies, so yes, you develop these kind of symptoms. And if you're taking for medicine, psychosis, have these kind of symptom, neurological symptom, restless leg syndrome. What are the signs or symptoms when you have restless leg syndrome? This is a neurological condition, neurological disorder, and yes, the major chief symptom is that you move your leg constantly, particularly during night or during rest time. There is a sensory symptom that you have abnormal sensation that something is crawling, there is a stretching kind of sensation, crawling kind of sensation, and we usually divide this in mild or moderate cases and severe cases. In mild or moderate cases, your symptom comes and goes, so you feel better sometimes, and you might think that these are the symptoms due to depression, stress. Or in severe cases, when these symptoms are constant, you face, have these symptoms on a regular basis. Every night you have abnormal kind of sensation, moving of leg, so on regular basis, then these are the severe cases, and these are very challenging. So yes, you need medical attention. Usually this affect bilaterally, means both the leg you move, but sometimes this is on one side. Move your leg because while moving you feel better, there is a betterment in your symptom. So this becomes your habit, that moving of the leg gives you some relief symptoms. Now, what are the diagnostic criteria? How we diagnose that this is a case of restless leg syndrome? There is no single test, there is no definitive criteria to diagnose this condition. There are certain neurological tests, physical examination, that you are moving your leg during night, during rest time, and you are having abnormal sensation. There are sensory symptoms. So these symptoms are the diagnostic criteria in restless leg syndrome. So your case, your history, whether you took any kind of drugs, or any kind of what age you fall. Usually this affect every age group. You had anyone in your family having the same problem. And your home remedies, in mild or moderate cases, you can treat it at home by following some habits, like these are limiting or reducing or eliminating certain substances like alcohol, caffeine, and tobacco, and having walk or doing regular exercises gives you proper motion in your legs, so you have lesser symptom. So start having walk and having doing swimming, so improves your symptom. You can do before going to bed, as this aggravate during night. So before going to bed, just do leg massage, or you can do warm compression, or even ice pack you can apply before going to bed. every day to relieve your symptom. Now, what are the homeopathic medicines? Best effective homeopathy medicine, I must say these are the couple of medicine, but not the only medicine in homeopathy. These are according to individual case history. There can be other medicine as well, and if you're watching on YouTube, you find all medicines link below in description box, so you can buy and you can use. Starting with Causticum. Causticum, see, you can go even with a smaller quantity. This is the clinical purpose quantity, and the company, the place you belong, the color may differ, even the form of the medicine may differ. Causticum is used in homeopathy when you have restless leg syndrome. There are twitching of muscles as well. So you're having twitching, spasm, and you are moving your leg constantly. So these are the keynote symptoms of Causticum, and this is the direct form. So just take 1 or 2 drops. Start with the lower dose, 30 or 200 potency, low power, lower dose, and use it regularly. Rhus talks in homeopathy is known for its restlessness. Patients they are impatient. There is remarked restlessness. So these are the keynote of Rhus talks, and with that you're moving your leg constantly and you feel better by motion. So you move constantly from one place to another because moving gives you relief. So these are the keynote of Rhus talks. And pain, muscular pain. So the keynote of Rhus talks. 1 or 2 drops, same way, 1 or 2 times before having Zincum metallicum. Zincum metallicum tops the chart. Number 1 remedy in homeopathy. Number 1 remedy in homeopathy for treating restless leg syndrome. So in Zincum, you have twitching, there are convulsions, neurological conditions are there. So this covers all the symptoms. The best remedy is Zincum metallicum, 1 or 2 drops, 1 or 2 times, same way before having your meal. Tarantula hispania. Tarantula hispania is the medicine that treats your restless leg as well as you are having restless arm. You move your hand constantly, you move your leg constantly. So these are the symptoms. Though movement aggravate your symptom, but still you move to get some relief. So Tarantula hispania, 1 or 2 drops, 1 or 2 times, same way before having your meal. The color is different. The color goes with the company, so the color is different. Arsenicum album is the remedy that a restless remedy. You have restlessness, and there is a remarked restlessness, and with the leg you move your head constantly. So if there is a movement of head, movement of leg, then these are the symptoms of Arsenicum album. Make out does in homeopathy, every medicine is different, and just pick your medicine according to your symptom. If you're watching on YouTube, you may find medicines link on given below description box, and you can use your medicine. So hopefully this video can give you some amount of help. If you find this video knowledgeable, informative, please like, share and subscribe my channel for further notification. Thank you for your time. Thank you for watching. Keep watching, keep supporting. Thank you so much. Thank you.